Much for being here. Really appreciate
Pleasure.
it. So, Dr. Cohn, you have recommended Peggy's program to some of your patients, Virginia being one of them, and we're going to talk to you in just a minute. Have you found it helpful, or in what way have you found it helpful for your patients?
Well, I think it tremendously relieves anxiety. And, you know, everybody going through surgery, no matter if it's the most minor kind, and this happens to be open heart surgery, which, you know, for...
In Virginia's case.
In Virginia's case. And it can be, you know, life or death, or, you know, people think of it that way. It's tremendously anxiety producing, and any program like this that can help relieve that will have better outcomes, in my opinion. I think it's very good.
What kinds of negative effects can anxiety have on a surgical outcome? You've been doing this, you told me, for 34 years.
Yeah. Well, they can get people awful nervous. It can produce heart rhythm disturbances. It can interfere with nursing care. Actually, they can be so anxious that they can have negative interaction with the people trying to take care of them because their anxiety is just overwhelming. So programs like this can really be very, very good in settling patients down, relieving that anxiety, looking at the positive aspect. I'm going to be great after I get over my operation. I'm so happy I'm getting it done, and these kinds of things, instead of looking at it as a tremendously negative experience.
Right. Do people ever get so nervous that a surgery gets canceled?
I'm scared to death, and I say, well, if you don't think you're really going to survive, I don't think I'm going to be the surgeon that wants to operate on you. But let's talk about it and see if we can undo some of these anxiety producing scenarios that are making you so fearful of it. And a lot of it's just education, which is a great thing that is done by Peggy's work. Just explaining what's going on, having supportive people all along the way, helping to educate patients as to what's going to happen. I think it's the fear of the unknown that's the greatest part of it. But having really skilled professionals all along the way explaining, from the nurses to the orderlies that take you around to the anesthesiologist, everybody is very, very helpful, and that reduces anxiety. Then if you have a program like this which gives you other aspects of anxiety-reducing programs, that's even better.
The patients can literally be scared.
Yeah, there's a phenomenon out there that it can happen. It has been known, and I've seen this very rarely, but it can happen that they're so anxious and they're so, but for no real physiologic reason, that something happens in the post-operative period, and it does happen very rarely, but it can happen. But we want to relieve that. We want to prevent that from happening. And
Virginia, you were almost one of those patients, but not quite. You were petrified before having open heart surgery. I think it was about 1.5 years ago with Dr. Cohn. And you found out about Peggy's program and used it. In what way was it useful for you?
The program was helpful for me in so many ways before, during, and after my surgery. Before the surgery, I was really nervous. I was out of control. I felt anxious. I felt scared.
That's a big surgery.
Yeah, I'd cry for no reason. I was mad that I was in this circumstance and that I'd have to go through this. And then I found the program, and it helped me to feel more in control of myself. I committed to the program. I listened to the relaxation tape every morning when I woke up. I listened to it every night before I went to bed. I felt like I had found a new friend that would listen to me and be able to advise me and make me feel supported and confident.
I'm curious to know what your visualizations were. What did you visualize before surgery?
Well, when I got most anxious, I would do my final end result, which was about a visit that my husband and I had taken to Europe, to Italy. We had taken it a few years ago when I still had the heart condition. And unfortunately, some of the nicest things in Italy are at the top of the hills. And I wouldn't be able to go to the top because I couldn't. I was too tired and too out of breath to make the trip. So I would wait at the bottom. Well, my visualization was that I would make the hike to the top. I would get to the top and I would see a beautiful white steeple at the top. I would look down into the valley. I would see the lemons that were growing there. I'd smell the basil. I would see the olives and the sunflowers that grew there. And I would see the beautiful sunny Italian day. And I was healthy and safe and having a really good time.
And do you think you had a speedier recovery? It's kind of hard to know what would have happened if you hadn't used the program. But did you recover quickly?
It certainly would take a research study to be able to answer that question. But for me, I really do believe that I did better with the program. I felt more comfortable. I felt more relaxed. I felt more in control. In fact, the nurses noticed that I was washing my hair in the sink the day after the surgery. And that's pretty surprising to walk in and find a heart patient that just had surgery yesterday washing her hair in the sink. So
right.
I think that
So you were feeling okay.
Yeah. I hope Dr. Cohn will do a research study to find out if that actually is true that I did.
Who is the most appropriate person for a program like this? Someone who's very anxious or fearful? What about kids? Would kids be an appropriate person for a program like this? Would they go through something like this, Peggy?
Well, if it's a young child having surgery, have their parents use it, because if you have really calm parents, you automatically get a calm child. But once, say, someone's 14 or 15, then have the child go through it and their parents use it too, and then everybody's calm and peaceful. But it's really for everyone. It's for the patient. You have to scrape off the ceiling with anxiety. So the patient is calm, because all of them will be given the tools to get even calmer and to participate in their healing.
You were talking to me earlier, Dr. Cohn, about the power of suggestion. And one of Peggy's healing statements is to use healing statements as people are going under the anesthesia or coming out of it. But you say that you think it's very useful to suggest to patients 2 weeks before surgery, when you're talking to them in the office, that everything's going to be fine. That what you say to them about the surgery can have an effect on the outcome.
Well, we have very excellent expectations of the patients following the surgery, and we try to give them that mindset that they're going to have a short hospital stay, that this is a physiologic operation. Let's say, like this lady had a valve repair, that they're going to get better very quickly, and they're going to get over this and get so much better after the operation. That's what they have to look forward to. This is not going to be debilitating. This is going to be improving, and that's what we suggest to them. And I think, in your case, I think that is very helpful to get you over that phase. It's not nice to have something wrong with you. But if you have something wrong with you, it's good to be positive about it. I want to get it done, get this physiology back to normal, and I'm going to be so much better when I get this done. Is that fair to say?
Oh, absolutely.
What about the power of prayer? One of the steps is to organize a support group and have them sort of pray for you, or at least send loving thoughts your way. Did you have a support group, Virginia?
I did. I actually felt that helped me a great deal to have a support group.
Did you feel people praying for you before this surgery?
As they were wheeling me into the holding area on the gurney, I could feel my friends, my family, my coworkers visualizing me wrapped in my yellow blanket of love and comfort and caring. It made a big difference to me. It made me feel more in control. It was probably the most powerful moment of my life, that feeling that I had the moment before I went into surgery.
Now, you are a man of science. I'm curious to know what you think of the power of prayer.
Well, I think it's good.
Sure can't hurt.
No, it certainly might help. You can't put any science or concrete rationality to it, but if it makes the patient feel good, that's good. That's really good. And I think that's perfectly fine. I was telling you, Portland, when you called me, that in many foreign countries where there is a tremendous shortage of nurses, that the family and the spiritual coming together of friends and family in places like Thailand and places like this, they do most of the care of the patient post-op, and the patients do fine. They do great. Not denigrating nurses at all, but a lot of sort of mundane things and just support and prayer and encouragement and all that stuff by friends and family is terrifically satisfying and very, very positive. That's all good stuff. I can't put the science to it, but it's got to be good.
It seems like it's about developing a relationship with your surgeon, developing a relationship with your anesthesiologist, and with your family and with your community. All of those things sort of help you feel more empowered, more in control, and safer. Safer, right?
I think that's fair to say.
Definitely.
Yeah. What about minimally invasive surgery?
Well, as Virginia had, she had a minimally invasive mitral valve repair. Now, many colleagues of mine around the country, around the world, don't want to do this because they say, well, we can't prove that it makes enormous differences. It turns
they can't prove that the program makes an enormous difference?
That's right. They can't prove that doing those kind of operations. We did early on, we did it at the 50 patient stop, and at the 100 patient stop, we had a nurse clinician call patients who had both the conventional surgery and the mini surgery, and they found that she would call them blind. She didn't know what they had, and she found out that these patients recovered faster, they felt like themselves faster, and they felt like going back to work 2 to 3 weeks difference shorter than the conventional operation. Now you might say, well, gee, maybe that's the power of suggestion, but that's okay.
you could possibly say that it's because they had minimally